Well, good afternoon, everyone, and Happy New Year to all of you. I know that this is the first time that we have been together in 2021, and we're all relieved to, I know, put 2020 behind us. I want you to know that we begin this new year with optimism. After many hard months, we can finally see a path forward for the world, for this great country of ours, and for our Commonwealth. As you know, 2 vaccinations are now available and more are being developed. These vaccines are literally our path forward. They are good, they are safe. I will take them, my family will take them, and I would encourage all of you to take them as well. Taking a vaccine is the right thing to protect your own health and also to protect other people. It's the way to stop this virus. It's our path forward to recovery, and it's the clearest way we're going to get back to something that feels like normal. But we all need to be clear that our country is in a very, very serious place right now. The virus is worse now than it has ever been. Case numbers are about 4 times higher than they were last spring. We had the highest case number every day, and we can expect it to go higher. In fact, the UVA model shows that cases could keep rising until Valentine's Day or even later. So we have a long winter ahead of us. We also need to be clear that new strains of the virus are out there. They're much more contagious than what we've seen so far. They're out in the world, and while we have not seen it yet in Virginia, it will surely make its way here, if not already so. So we have more hard work ahead for several weeks and months. For 10 months now, we have had just a few tools in our toolbox. You all know what they are. Staying at home, which I have encouraged everybody to do. Wearing a mask, washing our hands, staying 6 feet apart. I know it's no fun, but we need to keep it up, and I cannot overemphasize that. Then, 22 days ago, our country got the most powerful tool, the one that's going to literally change things. We're now 3 weeks into the most extensive public vaccination campaign in modern history. It involves science and medicine, researchers and doctors. It depends on regulators studying every piece of data to protect your safety and to make sure that the vaccination works. It involves highly complex advanced manufacturing. It requires moving supplies around the world and storing much of it at super cold sub-zero temperatures. This is complex stuff. And everything depends on thousands of healthcare providers. And I want to assure you that they are working very hard, night and day, and despite being tired and, quite frankly, worn out, they are literally our heroes. But we know how to do hard things in this country, don't we? It takes brains and it takes heart to do a tough job. And a little bit of luck doesn't hurt either. We've got all of that in this country, and we're summoning it right now to get this job done. And that's what I want to talk to you about today, because your country, our country, needs your help to move past this pandemic. You have an important job to do. So I want to tell you what you need to do, when you need to do it, and how it all fits into the larger plan. You deserve to know that as well. So let's start with the numbers, like we always do. Today we're looking at a few different numbers, and let's start with the big ones. The first number that you need to know is 8.5 million. That's about how many people live in our Commonwealth. The second number you need to know is 2. That's how many doses each person will need to receive. You get one shot first, then another one a few weeks later. When you multiply those numbers, you get 17 million. That's how many shots it will take to vaccinate everyone in our Commonwealth. So here's how we're going to get there. Right now, Virginia is receiving about 110,000 doses a week. Our first step is to use up all of that supply, to completely wipe out that supply, because we know that the supply will be replenished. That works out to about 14,000 doses a day. We're close to that now. In fact, today we added another 12,000 doses to that list, so we are on track. So next, we'll move to a clear goal, 25,000 shots a day. That's our next goal, and hitting it will depend on manufacturing ramping up and supplies being distributed to states over time. We don't have everything we need yet. No state does, because it's being manufactured literally in real time. That's consistent with the short-term goal that President-elect Biden has laid out for our country. But to get all Virginians 2 shots later this year, we know we'll have to double that. So let's talk about that. It will take a moment to achieve this. We're not going to get there tomorrow. We all learned that months ago when it became clear how important testing would be. Back then, we were testing about 5,000 individuals a day. We said we need to double it. We set a goal of testing 10,000 people a day, and we all celebrated when we hit it. And then we hit it again, and we kept hitting it over and over again. Today, we routinely test double that, sometimes triple that, or even more. Today, it's nothing to see 30,000 tests, 40,000 tests, sometimes even 50,000 tests a day in Virginia. We set a goal with testing, and we hit it. So we've proven that when we set a goal, that we'll achieve it. But it will take a moment to build up to. So let's acknowledge why that's true. And now that we have a baseline, we can ramp it up. We can be faster, and we're going to be faster. That starts with a simple message to healthcare providers, health departments, hospitals, clinics, pharmacies, everywhere. You use it or you lose it. So I want you to empty those freezers and get shots in arms. When you have vials, give out shots until they're gone. No one wants to see any supplies sitting unused. The companies are manufacturing more. They're working around the clock, and you're going to get more. So don't save anything. You're going to get every dose you need because more is coming. But if you're not using what you receive, you must be getting too much. So in the next shipment, we're going to allocate more doses to other places that need them. These numbers are going to be public so that everyone can see what supply is out there, where the doses are being deployed, and how quickly. Virginians, you deserve this transparency, and that's going to take a moment too. Over the past 3 weeks, everyone has been focused on getting shots in arms. It's taken a moment for reporting to catch up and for different computer systems to feed seamlessly into the Commonwealth Central Data Portal for immunization. I'm confident this will be seamless in just a few days. Now, I want to be clear. Use it or lose it does not mean that you go give shots to everyone who shows up. There's a clear prioritization of who should get shots first and who should get them in what order. People most at risk go first. We all know what that means. Healthcare professionals are first in line. People who care for people who are sick, they're most at risk. And if they get sick, then no one is left to care for everyone else. So nurses, EMTs, doctors, they're in group 1A. Then the next group of people who are at risk are people who live in our long-term care facilities, places like nursing homes and assisted living. They're at risk for reasons that we all know, and we've seen the facts. More than 30,000 people have died from COVID in the United States. Over 300,000, thank you, about 40% of them lived in nursing homes or assisted living centers. These are our parents, our grandparents, and people we love, people who just need a little extra help. That's why they are at the top of the list. Together, these groups represent about 500,000 people. Next on the list are essential workers. This is group 1B. So let's talk about what that means. Every worker is important, but certainly these are people who work in jobs that keep our society functioning, people who are at higher risk of exposure to COVID-19, and people who cannot work remotely. So let me give you just a few examples. These are firefighters, these are police officers, and hazmat workers. These are grocery store workers and people who work in plants processing the food that everyone eats. You don't eat unless these folks go to work. This group includes bus drivers and transit workers, the people who run the systems that help other people get to work. So if you rely on the metro or the bus to get to work and there's no one to drive it, then you're out of luck and your family suffers. That's why these workers are so high on the list of essential workers. And it includes folks in food and agriculture, corrections, and mail carriers. This list has been developed based on guidance the CDC has given to all states. It's good guidance and it's clear guidance. It also allows room for states to customize. We've done that in Virginia after consulting with healthcare professionals, experts in medical ethics, and lots of others. So I want everyone to understand one of the most important ways we are prioritizing who gets vaccinated. The largest group of frontline essential workers are our teachers, our child care workers, and anyone who works in K through 12 school. Let's be clear about this too. We all love teachers, and we value the work that they do to educate our children. But they're not high on the list just because we like them. They're high on the list of essential workers because teachers are critical to getting schools back open. And that's critical to people getting back to work and literally getting back to normal. Opening schools doesn't depend on vaccinating teachers, but that sure will make it a lot easier. So that's why we've chosen to put teachers so high on the list of essential workers. Now let me take a step back. This prioritization is very complex, like everything dealing with COVID has been. Everyone I just described is in groups 1A and 1B. This group also includes people aged 75 and older. Together, this is about 2 million people, and that's a lot of Virginians. So let's do that math. Once we ramp up, I'll take well into the springtime, it will take well into the springtime to get all of these folks the 2 shots that they require. Then after that is the next group of essential workers, people who work in transportation, food service, construction, energy, and more. It also includes everyone aged 65 and over, and that's about another 2.5 million people. All of these groups make up the first phase of our vaccination program. And remember, we have prioritized it this way. People who are most at risk first, then move quickly to essential workers whose jobs can help get everyone back to work and back to normal again. Everyone I just went through is in the first big group. Altogether, this is more than half of Virginia, and it really gets complex between groups A, B, and C. There aren't always clear lines between different subgroups of essential workers. So back to my message to everyone doing the vaccinating. Move quickly, please. Empty those freezers, clear those shelves, deploy those doses, show us shots in Virginia's arms. Follow the priority list. It's about fairness and equity, and it's very, very important. But please, you are allowed to use your judgment. If you need to make adjustments now and then, do it. We need to get as many people vaccinated as quickly as possible. This is all a lot of work, and we have to step up our game right when everyone is exhausted. Months of work around the clock with no time off and endless stress has left everyone spent and worn out. Our local health departments need help, and I want everyone in public health to know you are doing tremendous work. Virginia deeply appreciates it, and we're sending you help. So today, I'm appointing Dr. Danny T.K. Avula to lead Virginia's vaccination program. Many of you know Dr. Avula. He leads the Richmond and Henrico health departments. He is a board-certified physician and a specialist in pediatrics, like some of the best doctors I know. He studied at UVA and VCU. He completed residencies there and at Johns Hopkins. He has been named one of Richmond's top docs 7 years in a row, and local newspapers named him Person of the Year last year and the year before. He's a good man. He knows how to get things done, and he's the right person to bring extra help to our local health departments. He will be our field general, coordinating work between state officials, local health departments, hospitals, and private providers. He'll be working hand in glove with our team, who you know well, especially our health commissioner, Dr. Norm Oliver, Dr. Lori Forlano, Dr. Lillian Peake, Christy Gray, and everyone at the Virginia Department of Health. They are doing great work. As more doses arrive in Virginia, we will assign the National Guard to help with vaccinations. And Dr. Avula and this team will work with our military team to help coordinate where the National Guard goes and when they go there. And he will be part of the team you see here regularly with me to keep you informed and up to speed about the progress we're making toward our goal of 50,000 shots a day. You're going to see a lot of us in the new year. I know you have a lot of questions. People want to know, when is my turn? And when it is my turn, where do I go? I laid out the broad categories a minute ago, and we will have a lot more specifics in the days and weeks to come. But remember, we're 3 weeks and 2 days into this, and we're focusing on people who are most at risk first. So your turn is coming, but for now, unless you work in healthcare or live or work in a nursing home, you don't do anything. It's not yet your turn, but it will be soon. As that time gets closer over the next month, we'll be rolling out online tools to let you know where shots are available and how that you can get them. When your turn comes around, you need to be ready, and we'll make sure you have the information you need ahead of time. So you will be able to see a list of events, locations, and times. You'll be able to sign up online or by phone. We'll be going into the community and turning to trusted community leaders to help get the word out. These vaccines are really important, and we are personally committed to earning your trust. I know many of you have an even more important question, and that is this vaccine safe? And should I take it? My answer to you is yes. I believe that with all my heart, based on years of experience as a doctor. I will take it when it is my turn, and so will my family. I have full confidence in the process to develop the vaccines. Yes, it has moved quickly, but that's because the whole world went all in on developing the vaccines. It's not something to be worried about. It's a success story in a year that didn't have very many. I say that as a physician and as someone who has participated in more than 200 clinical trials over the years. I am confident that the proper process was followed for these vaccines, and I want you to know that I believe that. I also know that you believe in the old adage, trust but verify, and you want to hear from the most trusted man in the country. And who would that be? That's Dr. Anthony Fauci. I want you to talk to him, and I want you to listen to him. So please join us at 3 p.m. on Friday, this Friday, for an online question and answer hour with Dr. Anthony Fauci. Our health equity team and VCU's Massey Cancer Center have put this together so that Virginians can listen and learn. You can watch it live on our governor's office social media channel, so please plan to tune in. With that, I would like to ask Dr. Avula, and also welcome Dr. Avula, to say a few words, and then we'll be glad to respond to your questions. Dr. Avula, welcome.
Thank you, Governor Northam, and hello, everybody. Really excited to have this opportunity to serve with this incredible administration. Obviously, I've been really close to the work on the ground in Richmond and Henrico over the last year. And I think when I received the call and talked to my colleagues, Mayor Stoney and County Manager Vatulkas, they both recognized the value of better state and local integration. And so my hope in this short-term assignment is to come alongside Commissioner Oliver and the amazing team that is driving this work at VDH to help build some more of those bridges between the work that's happening locally and the work that's happening centrally, and really get after vaccinating Virginia. And none of this could be possible without the incredible team that we've assembled in the Richmond and Henrico Health Departments, who've just done such phenomenal work over the last year and are willing to stand in the gap for these next few months as I share my time here with this team. So thank you, Governor Northam, and thank you all.
Thank you, Dan. Appreciate it. Be glad to address your questions. Mel.
Hi, yeah, you compared vaccinations and testing, and you said the state had set a goal for testing, and eventually we got there. I think the difference to me is that testing was an all of a sudden challenge. We didn't have testing; it was a new virus. I think with vaccines, we definitely saw this coming. What are some of the challenges we didn't or couldn't foresee on vaccines? And I'll just tack on a second closely related question. I think some of the hospitals and facilities feel that maybe they didn't get enough guidance. Can you speak to that?
You know, Mel, there are a lot of challenges, as you probably know. I would just start by saying that we have vaccinated in 3 weeks a little bit over 115,000 individuals in Virginia. I'm happy to say that 2,000 of those have already received their second vaccination. So we're making progress, but there is no question that we need to, I think, speed the process up. We need to get more Virginians vaccinated. That's clear. The challenges, quite frankly, are challenges that are not unique to Virginia. I think if you look at the data across our country, and I speak with governors frequently, we're all facing the same challenges. And so, you know, when we see these challenges, we have to take action. And that's why I'm here today, and that's some of the announcements that I made today. Number one, we're setting goals, and they're goals that are achievable. As I've said, we're going to make sure that no doses are not being given to patients, to Virginians. We're going to ramp up to 25,000. That's certainly our first goal. And by the way, that's supply dependent. That's one of the challenges. We need the doses. And we have a partner in Washington who will help us receive those doses. I am very close to the congressional delegation. They have been working. We need the funding which they've been able to give us. So 25,000 is certainly our next step. And then after that, in order to get to 8.5 million Virginians vaccinated and having 2 doses of the vaccination, we're going to need to get to 50,000. And we're going to do that as soon as we can with Dr. Avula's help and continue the mechanisms that are in place. And that's what we need to do to make sure that all Virginians are vaccinated. And we'd like to do that by have all Virginians vaccinated certainly by the summertime and finally get this pandemic behind us.
Can you or somebody else speak to the level of guidance that was given to hospitals and to facilities that are rolling out the vaccine, and whether you feel that that was appropriate, and maybe whether we will see more guidance and prescription for those facilities and hospitals?
Yes, sure. Dr. Carey?
The question was whether the guidance that was given to the healthcare systems initially, what has been that experience, or do we think that we need to revise that, I think is the question. And we have gotten feedback. We work through the Virginia Hospital and Healthcare Association, the VDMAC, the Virginia Disaster Medical Advisory Committee, as well as personal conversations literally every day with health systems as well as health departments around the Commonwealth. How is it working on the ground? And again, the plan we've been working on for 10 months, but then when it hits reality and it has to be operationalized, that's where great learning occurs. And that's not a weakness, that's a strength. And one of the specific feedbacks that we got was that we had 1A, but then there was the first group with those who are in the intensive care units. Of course, the nurses and respiratory therapists and the doctors, those should be the first. It made sense. But in fact, over the last 2 or 3 weeks, they've said, you know, why don't we just have 1A and let us do all 1A at one time? And the governor's comments about that flexibility and getting shots in arms is exactly that. Do the right thing as you go through the priority list. And I'll give another example that consistent with what the governor just said, that talking with the health system this morning, some small counties, they're trying to plan an event for their healthcare workers outside of the hospital. But it's a pretty small county, and that is a relatively small group. Wouldn't it be much more efficient to look at that first part of 1B that the governor indicated, sheriffs, police, teachers, correctional officers? Couldn't they arrange an event? But that's in 1B. Are we allowed to do that? And the answer is yes, if it leads to operational efficiency and using our plan to its utmost to get the maximum number of doses in Virginians' arms. So there's an example that's not going to 1B statewide, but it's a local operational decision, and that flexibility and judgment that the governor mentioned. So we are communicating that in response to what the vaccinators are telling us, that hey, we want to follow the rules, and we don't want to break them, but we want to go faster too. So that is a good example of the governor's comments around flexibility as we move forward together.
Hello, good afternoon. So, Governor, are you aware of any health systems not using the vaccine they received, or vaccines going to waste? I mean, what's with the use it or lose it approach? You know, it seems kind of almost aggressive in a way.
Yeah, thank you, Alan, for that. And the question is, are we aware of any doses that are not being used that are, I guess you would ask, having to be disposed of? And to date, we haven't been. But we are just making the point, Alan, that when we allocate a certain number of doses to, for example, a hospital or whatever clinic, whatever site we are using out in the community, if those doses aren't being used, then the next request is they're not going to get the number, and they're going to go elsewhere where they are being used. So it's just a plan of being more efficient. There are also, you know, there are examples of when we set up sites, whether it be in the hospital or wherever, if the number of individuals don't show up to receive the vaccination, then we're obviously going to have doses left over. And so we don't want that to happen. And one of the points that I would make because of that is we move forward with this and get into phase 1B and then finally into the general population. I hope that everybody will follow the news, to follow the announcements, where these sites are going to be available, and really take the opportunity to be ready. And so when your time comes that you can get in, keep your appointment, get your vaccination, and then get your follow-up vaccination 3 weeks later. That is going to be very, very important. So we're going to request your help as we move forward, that you're all going to be part of the solution.
Aside from saying hurry up to the hospitals and local health departments, what else can you do to increase the vaccination rate? And then just to follow up from yesterday on the schools conversation with Secretary of Education, what's going on there? Can you send out any announcements about schools? Can you let parents know what's going on?
Absolutely. I'm going to answer your second question first. And we have had a lot of discussion regarding educating our children. I think we all agree, whether it be our children or whether it be families or our teachers, that we want to get our children back in school. We want to do it safely and responsibly. And so we're going to move forward with that, and I will have some comments. We just wanted to really focus today on the vaccination process and how we can make that more expeditious. One of the things that I announced, though, as you probably heard today, is that teachers are going to be a top priority. We want to make sure that all teachers that are willing to receive the vaccination are able to receive that so that we can keep them, and as well as other staff members. Also looking at a lot of other things, Henry, and I don't want to get into too much detail, but our children have suffered from COVID-19, as have our families. And one of the things that we certainly are entertaining is looking at perhaps a year-round schooling for the next year, perhaps adding increased days this summer to really help our kids get caught up. So a lot of good work is going on in that regard. Again, the bottom line, we want to get our children back in school. We want to do it safely and responsibly. And I'll have more to say. The Department of Education, our Secretary of Education, our Superintendent of Public Instruction, a lot of effort has gone into this, and we'll be making further comments soon. The first question you had is, how can we encourage hospitals to be more efficient or give more doses? And I think that's one of the themes of the topic today is that, I think we've gotten off to a good start in the first 3 weeks. We've vaccinated over 115,000 individuals, but we need to do it faster. And so we're going to work with the hospitals. We're going to work with the health departments. We're going to work with the sites, the clinics out in the communities, and we really feel that we can, be more expeditious and get more shots in arms. And the reason we're doing this is, and I'm committed to it, that's what will put this pandemic in the rearview mirror. And I just want to emphasize that with all the listeners, all Virginians, that we're all part of this solution, and get ready, because we're getting ready, and we're going to, as soon as we can get the doses that we need, as I mentioned, we're getting a little bit over 110,000 a week. We need more doses. We have a partner in Washington. We can use the Defense Production Act in order to provide more doses. But we're all a part of this team, and we want to get the pandemic behind us.
Bruce Potter, Inside Nova.
Good afternoon, Governor, and thank you for taking the questions. Two very specific questions for you. Number one, good goals need a timeline. What is the timeline or expectation for getting to 25,000 and then 50,000 doses a week, assuming that they are available? And then secondly, I think I heard you say, and correct me if I'm wrong, that the health department will be releasing more information, more details about where the vaccines were going to be distributed to. And I wondered if you could provide a couple more details on exactly what kind of information is going to be released there. Thank you.
No, two great questions, and I think your second question goes to when I can get the vaccine and where, and the public messaging that will go into that. And I'll let Dr. Oliver handle that and talk in a little bit more detail. The first is the question was, when will we hit 25,000 and when will we hit 50,000? And there are a lot of factors that contribute to that, and my answer would be as soon as we can. We, again, want to do this safely and responsibly. A lot of it will be supply dependent, and I think I've made that point already. But in order to get to 25,000 and especially to 50,000, we need more doses coming into Virginia, so we'll work on that. I think the other thing that I would like to say that is very encouraging and that is the help that we've gotten at the federal level from the recent relief package that was signed by our president. And I meet with our congressional delegation usually once a week. We have a very good open line of communication, and I've told them why we need help we need, and what particular areas we need that. I proposed $90 million, for example, in our budget that the legislature will be working on just a week from now. Federally, we're receiving over $100 million. So that's going to be very helpful as we deploy this vaccination. So, and there are a lot of other things that relief package does as well. So, you know, we're all in this together. We're getting good assistance from Washington, from a congressional delegation. So it's, as soon as we have the doses, our plan here is to be able to ramp this up, and all this will come to fruition. So that's the plan.
I think Dr. Aller is going to talk about the...
Yes. I didn't mean to leave you out. I'm sorry. Thank you.
Thank you, Governor.
Thank you.
The second question related to how will the Health Department get information out for people in the Commonwealth to be able to sign up and find out when and where they can get their COVID-19 vaccination. We have more than 2,000 providers who have already been registered with CDC and are prepared to be vaccinators. We have currently well north of 120 MOUs with pharmacies across the Commonwealth so that they can provide that. Federally qualified community health centers who stand ready to become vaccinators. And so tomorrow, if we were to decide that we wanted to order vaccine and move into 1B across the Commonwealth, we could order vaccine tomorrow. It would be here on Monday, and we could begin doing that. So we are ready, and when we get to that point, we'll be able to get that information out directly to the public on our site. We are currently setting up software whereby individuals can pre-register for vaccinations. We'll be working with their community-based providers, so there'll be areas where they can go. This information will be published on our website. We'll do a massive media campaign around it, social media, and other means to let people know where they can go become vaccinated. And hopefully this will be something that will be occurring in weeks.
Governor, I wonder how concerned you are about some of the higher numbers that continue to come from the state, and if you're worried about hospitalizations, and then specifically if you look at the events going on up in D.C. today, if you think that could be a super spreader event.
Yeah, thank you, Greg. Two questions. Let me answer the second part of your question. I regret it's very disappointing what is going on right now at our nation's capital, and absolutely when people are out and not using their distancing, not using masks, then obviously it can contribute to more spread of this virus. I would also make the point that I have been in touch with the mayor of Washington. Obviously we have our National Guard here in Virginia, and if there's anything that we can do to support her in that mission, we will certainly do that. As far as the numbers, Greg, they're very concerning to me. We had over 5,000 new cases today, over 30 additional deaths, and it's something that I get up and I look at that data every morning. As you know, we have put some significant mitigation measures in place. I think everybody is aware of those, the limiting the size of social gatherings, the mandate for both indoor and outdoor masks, the curfew after midnight, and we'll continue to follow those and encourage Virginians to follow those guidelines. And I think part of your question was, I think, really where the rubber meets the road, and Dr. Carey and I and our commissioner are in constant communication with our hospitals. We need to know what their capacities are, do need to know how their staffing is going, need to know whether they have shifted to eliminate or postpone elective surgery. So we have that communication on a daily basis, and if we need to take further measures to mitigate these numbers, all options on the table, and we will certainly do that.
ABC 13 News.
Hello, Governor. My question for you is, why have some other states been able to begin vaccinating the public, but that has not yet happened in Virginia? And when do you expect that to happen in the Commonwealth?
I'm sorry, other states have been able to vaccinate the public. Okay, well, I guess every state maybe does things a little bit differently, but we're obviously going to follow the procedures or the protocol that we have in place. And again, there's a lot of I think discussion and logic and reasoning behind what we're doing in Virginia. Obviously, we want to get out to the folks that are most at risk first, and those are our frontline healthcare workers and individuals that live and work in our nursing homes, and then we will expand the vaccination program from there, just as I described earlier.
Okay, just checking in. Hear you, the mask is muffled a little. So obviously, as you've mentioned, 1B and 1C are huge groups of people. So I'm wondering, has the state set guidelines for prioritizing certain professions within that group? And if you could speak a little bit more to how you're actually going to go through getting those out to people.
Do you want to address the different groups? I think we've kind of gone over those, but if you want to, yes.
Maybe the commissioner can follow up as well. So the question was really the guiding principle of the 1B, separate than the high-risk patient group, age greater than 75, and the others that you'll see, is on frontline essential workers, those that because of where outbreaks have been, where if they do their job, they cannot socially distance. They have to be in contact with the public or each other. And then those that are in 1C, the essential worker group also, it's the subgroup of those workers that can't do it from home. So it's not, whether it's transportation workers or whatever other group you want to talk about, but if you can do it safely from your home, if you're in accounting and doing a great job socially distancing and working remotely, then that you're not in that group. You would be in the general population. So we'll be giving much more concrete guidance as we get closer to getting into 1B, and that'll be in the days ahead as to when that guidance is going to go out. And I'll ask Dr. Oliver to maybe add some additional.
Jackie, the other part of your question is how are we going to organize to so as the governor mentioned in his remarks, what we want to do is to follow the prioritization, because that's been well thought through by our advisory work group, our health equity work group, the Virginia Medical Advisory Council, and our medical ethicists and so on. We feel that this will help us be fair and equitable in the distribution, but we don't want it to be a roadblock to our being able to, in a very efficient manner, vaccinate as many people as we possibly can as quickly as we can. So having that framework means that, yes, you should follow the order, but if you have 2 people who are higher up in the list and there's 10 others who are down the list a little bit, and you have 20 doses, vaccinate them all, right? There should be some flexibility there for the vaccinators, and that's an important point to get across. So we want them to follow the prioritization, but there needs to be flexibility there so that they can do so in an efficient manner. We have the providers for reaching all of those people. You mentioned the numbers. A lot of that will be what we call closed points of dispensing. So you can go to where the law enforcement agency and do a vaccination clinic right there. There are other places where we'll probably wind up doing like a community kind of site. If you're doing grocery store workers or something, you may not be able to rely upon the employer to set up a closed pod. We're working on that now. Our local health departments and the healthcare systems are beginning to have those discussions to set these things up, because we believe that we will be moving to this phase in short order.
Have you set prioritization yet, ordering like first responders, then childcare, then K through 12 teachers? Like, or I see what you're saying about the flexibility, but have we gotten that granular yet?
Yes, so later on today, in about 15 minutes, we will be posting the specifics on Plan 1B, Phase 1B and 1C. It will be on the website, and yes, there is a priority list for both phases.
Happy New Year to you, Andre.
Could you update us on some of your efforts to reach minorities who still say they are not going to take the vaccine? And then on sidebar, my second question is, we noticed that you've been traveling throughout the Commonwealth to assist different agencies and businesses and organizations. But Governor, there are still a number of people who are saying they can't get to a human being on the phone to file for their unemployment. They can't get calls back. So people are wondering, why wouldn't the governor put more time and energy and money into the website to help struggling Virginians?
Yeah, I'm going to have Dr. Healy come up and answer your second question, but I will entertain your first question and answer that as best I can. And that's something, Andre, that is, I think, the trust issue across Virginia with, receiving the vaccination. Is it effective? Is it safe? And I certainly understand the history, and I understand the question of trust there. And we dealt with a lot of that actually during the testing. And one of the things that we did to address that, one of several things, was to form our Health Equity Commission. Dr. Janice Underwood leads that. And that worked in several different areas. One, it worked to establish sites, testing sites, and we'll do the same thing with our communities, with the vaccinations. We'll be going out to the communities with mobile units. There will also be sites out there that will be established where individuals that have the transportation will be able to get to those. So that's obviously very important to us. And then we'll continue to work with our community leaders and especially our faith leaders. They were very helpful when it came to the trust issue with testing, and we've been in contact. Janice has been in contact, and we'll continue that dialogue and ask for their assistance as we move forward. But if you look at the numbers, Andre, about 60% of the population has said they're willing to receive the vaccination. I would like to see it higher, quite frankly. So Dr. Avula and I and Dr. Carey and Dr. Holler, we'll be working on that with Dr. Underwood and the rest of our staff and community leaders to really get that message out there that, one, it's safe, and also how important it is. If we all want to get back to our near normal lives, we want to get our kids back in school, we want to get our businesses open again, and in order to do that, we've got to get this pandemic under control and get a large percentage of the population vaccinated, and so we can move forward. So we'll keep working on that.
Virginia pilot.
Oh, hey, Elena. We were going to have Dr. Healy address the unemployment. Yes. Thank you, Dr. Healy.
So the question was around unemployment insurance and the communication between the Employment Commission as well as the claimants. So in November, we were taking over 100,000 calls per week, which is an ultimate goal through our call center. We actually saw a decline in December. It was around 60,000, so there was some room. But we know there's still struggle because a lot of people call at the same time first thing in the morning. Monday, we implemented a callback feature. So now everyone can call, and that you, instead of waiting on the phone in line, that someone will call you back within that day or the next day. And so we're happy that we've moved to that. Communication, Governor Northam asked the Commissioner of the Employment Commission. We had people who are in the determination process. That means they're in that that appeals adjudication process, that we're not getting payments, that we move people to payments in December as well, to kind of to help support them through this winter issues. And so I think that's alleviated some of the calls. A lot of times someone's in that appeals process, because it's a long queue, we're not sure, like tomorrow's your hearing or it's next month. And so we're working on better technology. The governor also, in his introduced budget, put $9 million towards more customer service at the Employment Commission, as well as $5 million to improve the technology to better communicate through portals.
Thank you, Megan. I'm going to take one more question on the telephone, and then we'll wrap this up. Thank you.
All right, so we'll go to Alicia Sowers now, Virginian pilot.
Hi, thank you. I don't think I heard it in terms of what the goal was to have all Virginians who want it vaccinated. Is that by summertime, by the end of the year? And then the second question I have is, what is the threshold that you're trying to hit before you're ready to begin expanding to the 1B priority group?
Yeah, two questions. The goal is to have everybody vaccinated by this summer, and I think if we do the math of 50,000 individuals a day, that's what will get us to that goal. And your other question, please?
What is the threshold you're trying to hit before you're ready to expand to the 1B priority group?
Yeah, no, so the second question is what are the criteria before we go from 1A to 1B, and that will essentially be the work that Dr. Avula, Dr. Carey, Dr. Aller, and I will continue to communicate with our hospitals and our long-term care facilities. When we're comfortable that the majority of those individuals have been vaccinated, we'll move to 1B, and we may do that in some areas sooner than others because, as you all know, some areas of Virginia are ahead of others. So flexibility, I think, is a good word as we move forward, and we're certainly going to be flexible and make sure that we get all of Virginia vaccinated. Thank you all so much for being with us today. I know there's a lot of news going on in our country today, but to the press, thank you all for taking the time to be with us, and to the viewers at home, we appreciate you being part of this as well, and we look forward to all working together and, as I said, get Virginia vaccinated as expeditiously and safely as we can, and getting this pandemic behind us and getting back to our near normal. So thank you all. Stay safe and healthy, and we'll look forward to being with you soon. Thank you.